Today, the U.S. Surgeon General declared gun violence as a public health crisis, which comes as no surprise to doctors in our city. Stroger Hospital saw more than 770 gunshot victims last year. Their trauma center is one of the busiest in the country.
Tara Molina got exclusive access today. She joins us now live from the newsroom. Tara, they talked to you about the impact this advisory will have here.
That's right, Jim and Marie, and they called it a long time coming. Keep in mind, we're about to take you inside the busiest trauma center in the country. But they wanted to be clear, the impact of gun violence is felt by more than the gunshot victims they treat directly. And that's the approach they say this advisory addresses.
We're in our shock trauma room for our trauma department.
771. That's how many people were rushed into a room like this one at Stroger Hospital with a gunshot wound last year.
Cook County has the busiest trauma center in the United States. We were the first trauma center in the United States.
And it's personal for Chief Medical Officer Dr. Claudia Fegan. She's done more than dedicate her life to helping trauma victims. She grew up on the city's south side, and her own experiences with gun violence paved the way to her decades spent working here.
My parents were injured in gun violence when I was a child. They were held up at gunpoint. My father was shot. It was a trauma unit that saved his life.
Her take on this landmark advisory from the U.S. Surgeon General:
it's like long overdue.
More people are shot in Chicago than in New York City and Los Angeles combined.
We lost a 7-year-old this past week to gun violence.
The advisory points out more children between 1 and 19 die from guns than anything else in the United States. It's one reason treatment here goes beyond medical attention.
I've met grandmothers who are sitting on a park bench who were shot waiting for the bus. I've met children who were shot in the back seat of their car while they were driving to school.
Andy Wheeler is a clinical social worker. He steps in to work with gunshot victims and their families while they're being treated here in the hospital.
Acknowledging that gun violence is a public health issue is one step in the process of working with patients heal from their traumatic injuries.
The U.S. Surgeon General is calling for the U.S. to ban automatic rifles, introduce universal background checks, pass laws that would restrict their use in public spaces, and penalize people who fail to safely store their weapons in this landmark advisory. But that's not all. The advisory also says more money needs to be dedicated to firearms research to understand how to reduce and prevent firearm violence, something that people here say will make a major difference in Chicago.
There's been so much lobbying against this that has prevented us from doing the public health, the research to find out what works and what doesn't work.
Our investigative team poured through more than 50 years of data and found while the numbers here are startling, the early 90s were the worst for Chicago homicide-wise. Coming up at 6, doctors tell me why treating gunshot victims now is so much more complicated. Reporting live in the newsroom, I'm Tara Molina, CBS 2 News.
Tara, thank you, and stay with us. Coming up at 4:30, I spoke with the Surgeon General, asking him what this declaration means for gun violence victims and those impacted by it on a wider scope here in Chicago. You'll hear his answer in just a bit.